Hi everyone, this video will give you a brief overview of diabetic neuropathy. For some key background information, diabetic neuropathy is a common complication of diabetes mellitus, and it is characterized by damage to the nerves, which can lead to a variety of symptoms. It is quite common and affects approximately 50% of patients with diabetes, and the symptoms it can lead to includes things such as pain and tingling, but even some autonomic dysfunction. Some people, however, are also asymptomatic, which is why some screening tests exist in the UK. And there are four main types of diabetic neuropathy that I would like to discuss today. The pathophysiology of diabetic neuropathy is multifactorial and involves metabolic, vascular, and neurodegenerative mechanisms, and the level of diabetic neuropathy is often linked with patients' blood glucose levels. The main four types of diabetic neuropathy: firstly, you have peripheral diabetic neuropathy, and that typically presents with numbness, tingling, or burning. You can also have symptoms such as erectile dysfunction, or very commonly foot ulcers, which are screened for in the UK. Autonomic dysfunction includes bowel problems, issues regulating your blood pressure, gastroparesis, which is the motility issues within your gut, and you can get urinary incontinence or retention. Mononeuropathy, sort of self-explanatory, you get weakness or pain, usually in a single nerve, sensory loss, or even reflex loss, depending on what nerve is affected. Lastly, you can also get radicular plexus neuropathy. Usually the lumbosacral radicular plexus neuropathy is discussed, and it refers to a group of peripheral nerve disorders which cause issues with the proximal leg, and it can present as sudden unilateral pain in the thigh and hip and a progressive lower extremity weakness. In terms of the investigations, firstly, you can do a fasting blood glucose, which typically would be raised and typically more than 7 millimoles per liter or higher. And important test to consider is the HbA1c. It will be typically elevated, and above 48 millimoles per mole is the level in patients with diabetes. And what the HbA1c looks at is the blood glucose levels over the last 3 months, which gives a better indication of how well glucose levels are controlled by the patient for a prolonged period of time, and allows the physician to see whether they are good with the diabetic control or whether they need any support or perhaps medication change. Other tests to include are the full blood count, B12, thyroid, and liver function tests. This is purely to exclude any other possible causes of neuropathy. Lastly, and not included on the slide, you want to discuss things such as screening programs in the UK with regular checks for any foot ulcers, etc. The management depends on the presentation. For pain, you can use pregabalin or gabapentin, which are very important medications used for neuropathic pain, but you can also use antidepressants or sodium channel blockers. For mononeuropathies, it is mainly supportive measures, things such as proper foot care and antibiotics if there is a risk of infection, as patients with diabetes are at an increased risk for developing infections. For autonomic disorders, firstly, orthostatic hypertension can be treated with midodrine or midodrine, depending on how you pronounce it. Gastroparesis, you can use erythromycin, which has been shown to increase gastric emptying, and metoclopramide, which is an antiemetic. For bladder dysfunction, you can use berthanacol, which is a parasymphomimetic agent to help control the bladder. And in terms of general advice, you want to do regular glucose monitoring and adjust the medication for a patient if the current levels are high, but also discuss their diet, whether it's been changing, whether they're struggling to keep up with it, or whether there's anything that can be done to make sure that they minimize the amount of quick releasing sugar in their diet. This was a very brief overview of diabetic neuropathy. If you have any questions, feel free to leave them down in the comments. Other than that, thank you so much for watching. I hope you consider subscribing.